the world and an increase in deaths. This is no time for complacency, especially with holiday season approaching in many cultures and countries. We all want to be together with the people we love during festive periods. But being with family and friends is not worth putting them or yourself at risk. We all need to consider whose life we might be gambling with in the decisions we make. The COVID-19 pandemic will change the way we celebrate, but it doesn't mean we can't celebrate. We still can celebrate. The changes you make will depend on where you live. Always follow your local or national guidelines. The first question to ask yourself is, do you need to travel? Do you really need to travel? For many people, this is a season for staying home and staying safe. Celebrate with your household and avoid gatherings with many different households and families coming together. If you do meet people from a different household, meet outdoors if you can. Maintain physical distance and wear a mask. Avoid crowded shopping centers. Shop at less crowded times and use online shopping if you can. If traveling is essential, take precautions to minimize the risk for you and others. Maintain distance from others and wear a mask when you're in airports and train stations and on planes, trains, and buses. Carry hand sanitizer with you or wash your hands frequently with soap and water. If you feel unwell, don't travel. If we can't celebrate as normal this year, make a plan to celebrate with your family and friends once it's safe to do so. We know it will be safe. It's a matter of time. The pandemic will end, and we all have a part to play in ending it. And we must remember that for millions of people, COVID-19 is only one health threat they face on a daily basis. Tomorrow is a World AIDS Day. The world has made incredible progress on HIV/AIDS over the past 10 years. New HIV infections have declined by 23% since 2010, and AIDS-related deaths have fallen by 39%. A record 26 million people are on antiretroviral treatment, but the pace of increase has slowed, and that leaves 12 million people who are living with HIV but are not on treatment, and 12 million is big. That gap is jeopardizing our goal of ending AIDS as a public health threat by 2030. COVID-19 has had a profound effect on people living with HIV, as it has for many diseases. There is some evidence that people living with HIV may have an increased risk of severe disease and death from COVID-19. This increased risk has been compounded by disruptions to treatment for people living with HIV. In a WHO survey of 127 countries earlier this year, more than a quarter reported partial disruption to antiretroviral treatment for people with HIV. However, with support from WHO and the work of health and community workers, the number of countries reporting disruptions in HIV services has declined by almost 75% since June. This is a good news. only 9 countries are still reporting disruptions, and only 12 report a critically low stock of antiretroviral medicines. This is mainly due to countries implementing WHO guidelines, including providing longer prescriptions of antiretrovirals for 3 to 6 months. No patients can avoid health facilities. WHO has also worked closely with manufacturers and partners to ensure adequate supply of treatment. Countries have also introduced a number of effective adaptations and innovations during COVID-19. In Africa, many countries have built their testing system for COVID-19 on the existing lab infrastructure for HIV and TB. In Thailand, the government has maintained pre-exposure prophylaxis services and telehealth counseling for men who have sex with men. And many countries have introduced more self-testing for HIV to support self-care and avoid the need for people to visit clinics or hospitals. WHO is urging countries to maintain these innovations as part of the new normal and to help expand testing and treatment to people who need it. But if the pandemic has taught us anything, it's that in the face of an urgent health threat, the world can come together in new ways to defeat it. For many people, the pandemic is a source of fear, but it can also be a source of hope that we can defeat COVID-19 and we can defeat HIV. And there is a lot of hope, especially with the advent of the vaccines that have been announced in the last few weeks. And from WHO's side, we are sure that we can defeat this pandemic using the existing tools and also the vaccines that are in the pipeline. The most important thing is we need to have hope, and not only hope, but solidarity, to work together to fight a common enemy, using the existing tools and also the new announcements of vaccines in the pipeline. I thank you. Back to you, Margareta. Grazie mille, 500 anni.
Grazie mille, Dr. Tedros. So now I will open the floor to questions. As I mentioned before, Dr. Meg Doherty is here. She's our director of our global HIV programs to answer your questions related to World AIDS Day tomorrow. So please take the advantage of such expertise. We will, as you know, I'm sure, use the raise your right hand icon to get in the queue to ask your questions. And I would also have to remind you that we restrict this question to one per journalist, though you have all been terrific about this. So without further ado, I will give the first question to Carmen from Politico. Carmen, please unmute yourself and go ahead.
Hi, Margaret. Thank you. I do have a question for Dr. Mark Ryan. I was wondering if you could tell us at all the way the experts in the virus origin mission were selected, how many they are, and if you can give us more or less a timeline on when the names will be made public. Thank you.
Hi. I think the names are public, and the selection, we put out a call, I think, for names and suggestions for the team, and the process was to select a diverse group of individuals representing a geographically diverse group who represent the necessary expertise, and that was really